Imagine that you're looking through a filter all the time. Imagine that you're looking out of your window and your window is muddy. That's pretty much the view that a person with cataract has. Somebody has cataract, basically they're not getting enough light in their eye, and the light that they do get inside your eye is not clean. By that I mean, if you look at the source of light, the source of light appears to have spears through it, appears to have glare around it, appears to have halos around it. This is very commonly noticed when they drive a car during the nighttime, and they find that oncoming headlights cause them a lot of grief. Also, people find out that during low light conditions, they're not doing as well. They can't read the reading material that they're supposed to read. So at first, we try to optimize the remaining vision. We make sure the person has best possible glasses that is appropriate to their age. And we also make sure we use the anti-glare technology as best as we can to cut down on the amount of glare. But sooner or later, no matter what we do with the eyeglasses, we can no longer correct this person's vision. Once we make sure there's no significant other problem going on, and the cataract is the primary problem for vision loss, we decide on cataract surgery.
Mr. Clue, there are different types of lens implants that you can pick from now for surgery. Your first choice is
My name's Marissa. I'm the IOL counselor here at Access Eye Centers. I inform all of the patients about the different types of lens implants they have offered to them now for cataract surgery. Everybody has the option of the basic lens implant, which is covered by their medical insurance. That lens implant is pretty much going to improve their vision, but a patient will have to wear glasses afterwards for surgery, for their distance and for their near vision. Their other options are called our lifestyle lens implants. One's called the crystal lens. It's great for distance, and then that's also going to give you somewhat of a reading vision at your intermediate length, so computer work, cooking, anything at that focal range. The other lens implant is called a Technis multifocal. That's great at distance, and that's also going to give you your closer up near vision, so when you're actually reading a book.
Why did you so straight?
We do extensive measurements for them. Not only do we have to do a glasses prescription for them to see where they stand, we also have to do an ACN measurement, which measures the different parts of their eye. So it helps Dr. Mansouri pick the proper size and power of lens implant for the patient.
We'll be right in here. This is Maggie, the surgical coordinator. She'll
Hi,
get you all
Maggie.
signed up today.
Hello,
how are you?
Pleasure to meet you.
Nice to meet you.
Phil.
I schedule a patient for surgery, make sure that all their documentation, order their lenses, make sure their insurance is good, send over all their prescriptions they'll need, coordinate with the surgery center, and get them ready to go.
That'll work well.
That sound good?
Yeah.
Okay, great.
On the day of a surgery, you show up at the surgery center. We'll have a microscope that is hanging from the ceiling. I'm going to be looking down at the patient. We'll put some eye drops in their eyes to make it numb, enter the eye with a very fine instrument, put some more anesthetic inside of the eye so the person doesn't have any pain, remove the cataract with an oscillating instrument. Most patients are completely awake during cataract surgery. Nobody has to go to sleep. Most of the time you have enough sedation that there's really no real anxiety about this. And there's certainly little to no pain at all. The surgery itself takes 5 to 10 minutes, and all along I'm talking to the patient, and we really try to cut down the anxiety as much as possible. The first multifocal lens implant that I implanted was in my own mother. I waited for this for years and years and years until the lens got approved, and after the lens got approved, I've had so much confidence in this that I wanted to have my mother as a first patient. And it worked beautifully, and up to date, she's doing quite well. She's reading things without glasses, she's driving without glasses, and she's quite happy. Patients who've had very bad cataract and they haven't been seeing for a long time quite often get up from the cataract surgery table and say that I can see a whole lot better already. But most people haven't had that bad of a cataract, so their vision is not that severely affected. So for this person, it takes a while for him to realize that yes, I am seeing better. In most circumstances, about a week after cataract surgery, most people start seeing better. If you've had no other underlying condition and the only problem that you've had is cataract, then you're looking at very, very successful surgery in excess of 97–98%. We've had many years of combined expertise in doing cataract surgery. The office has been part of this community for 30+ years. We employ a wide team of ophthalmologists and optometrists working together to get you the best result. This is why I went to medical school. It gives me tremendous satisfaction, tremendous sense of achievement when I take someone's cataract out. Especially when you have a black and white case of someone who's absolutely seeing nothing, and then next day they're seeing something. And you can't buy that with any amount of money.